Hi everyone, this is Julie, your medtech buddy. So it's been 3 years since I've started this program BSMLS, and finally I can show off what I have learned and what I have realized in this program through a case presentation. So let's first meet our patient. Mrs. Elizabeth Aguilar is a 60-year-old woman currently living in the nearby town of Santo Tomas. She went to the hospital with complaints of severe pain and swelling observable in her right leg, which has prevented her from doing daily chores and necessities. Upon closer observations of her pain, she had panicked upon realizing that her right leg was seemingly growing bigger and bulging more and had increased in size as compared to the other. Recently, she had just undergone a major surgery to remove a tumor from her colon as she had a history of long-standing type 2 diabetes and was undergoing insulin and metformin therapy. The pain in her leg was something she had assumed to be normal and associated it with the after effects of the surgery until the pain became somewhat unbearable. Now, together with my groupmates, let's analyze this case presentation. As for the prescribed medications, Mrs. Elizabeth received metformin and insulin for diabetes management. On the other hand, the given post-surgery medication was intermittent morphine administration and acetaminophen for pain medications.
Upon an interview conducted by her physician and nurse, the following is presented to be a timeline of her recent events leading to the point of her hospital visit. On day 1, the patient had undergone colectomy surgery. On day 2 to 4, there is initial report of good prognosis. On day 5, the patient developed an complaint of severe pain and swelling in the right leg, accompanied by visible redness and warmth with noticeable enlargement.
Now let's move on to the test ordered by the physician and how it is essentially related to our patient diagnosis. First of all, we have a CBC or complete blood count. Now these tests are routine tests ordered for the laboratory to evaluate a person's circulatory system by assessing the different values of different components of the blood. A physician will rule out diseases not associated to the affected levels of blood components. Next, we have a prothrombin time and an activated partial thromboplastin time. These tests are used to evaluate the blood's ability to form clots by assessing the different factors associated with the coagulation cascade and its pathways. Abnormalities typically result in prolonged clotting times, which are then indicative of some abnormalities or defects within the coagulation cascade. Again, the physician will then exclude diseases not associated to prolonged clotting or bleeding times. Finally, we have the D-dimer test, which is essentially a screening test for blood clotting disorders. It evaluates the amount of D-dimer subunits circulating within the body, as these subunits or proteins are important for the formation of blood clots as it allows platelets to bind to each other. Now, elevated levels can be used to suggest the presence of a blood clotting disorder, and in this case, we can assume that a D-dimer test positive result is suggestive but not diagnostic of deep vein thrombosis, but a negative result will exclude deep vein thrombosis as one of the possible diseases for a diagnosis.
Test results that was conducted on Mrs. Elizabeth Palmer. So for the first one is the complete blood count or the CBC, which falls within the normal range, which indicate a normal count of red and white blood cells, as well as adequate hemoglobin and platelet levels. So for the second one is the D-dimer test, which reveals an elevated levels of 1.5 microgram per milliliter, surpassing the normal range of less than 0.5 microgram per milliliter. So an elevated D-dimer test levels suggest the presence of fibrin degradation products, which can be associated with various conditions, including the deep vein thrombosis. So for the third one is that venous Doppler ultrasound, which confirms the presence of deep vein thrombosis on the right leg. So the DVT is the formation of blood clot in a deep vein, typically occurring in the lower extremities. So for the fourth one is the PT or the prothrombin time is slightly prolonged with a value of 15 seconds, exceeding the normal range of 11 to 14 seconds. So a prolonged PT may indicate normalities on the extrinsic pathway of coagulation, which can affect blood clotting. So for the fifth one is the APT, the activated partial thromboplastin time, which falls within the normal range, suggesting that the intrinsic pathway of coagulation is functioning properly.
So after let's discussing all the involved tests as well as the result, let me break down the correlation of these test results and symptoms for you. It turns out that the patient has been dealing with some serious swelling and intense pain in her right leg. And my take on this is as a medical technologist who relies based on all the test results. Presented is a deep vein thrombosis or DVT. But what exactly is DVT? Deep vein thrombosis is a condition where a blood clot forms in one of the deep veins, usually in the leg. These veins are responsible for carrying blood back to the heart. When a clot develops, it can obstruct the blood flow and cause various complications. Now, the symptoms of the patient experience, like the swelling and the immense pain, are the common signs of DVT. When a clot forms in a deep vein, it can lead to swelling, pain, and sometimes even warmth and redness in the affected area. So it all adds up. And to confirm the diagnosis, the D-dimer test came back elevated, which is a good indicator of a blood clot. Additionally, the ultrasound findings were positive, further supporting the diagnosis of DVT and the patient's life. Now let's talk about those slightly prolonged PT test result. The PT test measures how well your blood clots. In the patient's case, the slight prolongation could be due to the trauma her blood vessels experienced during the surgery on her leg, and is a common side effect of such procedure. However, considering other potential causes of DVT like inherited clotting disorders or malignancies, but based on the patient's medical history, recent surgical procedure, and medication regimen, this cause seems less likely in her case.
Based on Ms. Aguilar's history, symptoms, and test results, she has developed deep vein thrombosis in her right leg as a post-operative complication. The incorporation of diagnostic tests like D-dimer assay and venous Doppler ultrasound has enabled early detection and identification of the condition.
That was a fruitful sharing of information. This case underscores the importance of managing coagulation complications in high-risk surgical patients. The administration of prophylactic anticoagulants and prompt identification of symptoms and risk factors can aid in preventing life-threatening conditions like pulmonary embolism. Advanced medical technologies have significantly improved our ability to diagnose and treat complex coagulation complications, ensuring better patient outcomes.